Welcome back to the Well I Am podcast. Today we're talking about skin and all things wellness with skin and all the things we do to fix our skin. And with us today, Dr. Vindea. Nice to have you with us. Thank you.
Thank you for having me. It's nice to be here.
I'm so excited to see you outside of the office. I've seen you in Westville.
Scrubs, though.
I see you in your scrubs. It makes you look like it's very important and fantastic. How many years did you study for aesthetics, by the way?
You don't actually study in med school for aesthetics. So it's purely... I am so sorry.
No problem. An aesthetic doctor. Mm-hmm. All right. So you became a doctor first.
Yeah. So we study at med school. We do the whole internship, com service, go out into general practice. It's not a field that was brought in when we were studying. So it's a new field. So everything that you learn, it's after varsity. And a lot of it is self-learning, sadly. A lot of it is diplomas. So learning by correspondence, practical courses,
Can you do aesthetics and not have done med school?
No.
Okay, so
not in South Africa, no.
So you have to be a doctor
or a dentist.
Or a dentist in order to go into aesthetics. Aesthetics, is that specifically face skin?
So anywhere on the body, but it's injectables and it's non-permanent.
Oh.
Or it's semi-permanent, but it doesn't involve surgery.
Injectables, non or semi-permanent, doesn't involve surgery anywhere in the body.
Yeah.
So, I wouldn't come to you for moles and that kind of thing.
You could if I was trained in it and I'd, feel confident to do it. I mean, at the end of the day, we're still generalists, so we can still treat medical conditions. It just always depends on how experienced your provider is with the service that they're providing.
Okay, so on the general days, before we get on to skin and environmental factors and whatnot, on your general day, what is the kind of thing that you're doing?
So I'm only in aesthetics. So I stopped general practice a while ago to focus purely on aesthetics. So for me, I didn't really want to be dealing with chronic conditions. I wanted this to be my priority. So on a general day, I'm seeing patients coming in because they want a bit of enhancement. They want to feel better about themselves. They just want to go on a healthier aging journey. And this day and age, we're also much more focused on well-being, how we look, how we portray what we feel, that it's a perfect market because everyone's interested in being their best self.
Do you see the direct difference or I don't want to call it the parallel between a woman or man who's had something done externally and that translating to them actually internally feeling better and therefore becoming a better person in essence?
For me personally, I believe that it's a confidence builder. Okay, so I've seen it in my practice where people are really, riddled with insecurity issues. And just that one treatment is enough of a catalyst to make them start a whole mental mind shift. So it has positive repercussions. On the flip side, you see a lot of people who are slightly depressed to the point where you do need some kind of balancing agent in the body because no matter what you do to yourself, you still have this very negative conception of yourself. And so it kind of doesn't help in that way. So it's very much here or there, but usually we'll be able to spot the patients who do have a bit more of a sinister problem that needs more interventions versus, generally happy people with just a little bit of insecurity.
So we are the Well I Am podcast, and it's all about wellness. And so obviously when it comes to wellness, it's your emotional wellness, your physical wellness, mental wellness, everything. Yeah. How we look obviously translates to how we feel. Yeah. Just like someone who wants the tablet to lose weight rather than going and doing exercising, where is the line drawn between me smoking cigarettes, going out in the sun, no sunscreen, being around pollutants all the time, and then just popping into you to look better, but actually I'm no healthier, versus making sure I've getting enough water and using my sunscreen, and then also using you to enhance. I mean, is there a fine line? Is it one or the other?
No. I mean, we're going to get patients, clients, whatever you want to call them, coming with a very different perspective. A lot of times we can advise you as to healthier lifestyles. A lot of times patients are not going to choose that because if you're a smoker, you love smoking and that's it. Okay. So for me, it's just to kind of give you within what you're acknowledging some kind of treatment plan that fits your lifestyle. And if you take my advice a little bit more deeper and you invest a little bit more, it's for your benefit. But at the end of the day, I can preach to you as much, but if you're not sold on it, on the lifestyle change, it's going to be hard. But if you want better results, it has to be more of a holistic intervention. Okay. Because at the end of the day, like you said, you can put as much Botox as you want to in your face. If you're still in the tan can, trying to get as brown as possible, smoking, stressed, etc., you're not going to see the benefits of having these treatments. So by and large, you're investing in something that has a very limited outcome.
I guess it's like being on the treadmill while eating a burger,
Exactly.
What I was going to ask you is, if I just say to you, what do you see from your patients, clients, has the worst effect on the skin? So what is so what kind of daily, whether it's intake of food and or drink, or it's, as you mentioned, a tan can, what are the things that you say affect the skin the most negatively? Man, woman, race?
So in most different categories of patients, it's the sun and it's smoking. Okay, so with the older clientele, it's years of sun exposure, not being aware of sun protection, sun avoidance, those kinds of things, and smoking cigarettes. Okay, for the younger, it's the vapes. And
so you're seeing the vapes are causing...
The vapes are going to really come back to knock us in about 10 years, which is why it isn't a healthier alternative. It's just a different way of doing something that's already...
So then how are the vapes affecting skin? Drying them out, making them break out?
It's a nicotine-based product. So it's not how you're doing it. It's what you're taking in.
Hey, okay.
So yeah, the fact that now if you're starting vaping when you're a teenager, remember that you can do it anywhere.
Yeah.
It's going to smell like blueberry pancake or
candy
whatever.
Floss, yeah.
So you're not going to get into trouble with it. I mean, teens start at like 13, 14 these days. It's scary.
You get away with it on a plane
it's
even.
So easily available as well. So it's now a new kind of habit that is going to, negatively affect. And you do see it in the late 20-year-olds. Okay? Yeah. They are coming with skin concerns that they shouldn't really be having. And that's because they are a bit more easy on the vapes.
So from the vapes or cigarettes, sun damage, do you see the sun damage across all boards? Or is it because the whole like black don't crack?
Yeah.
Are our brown sisters and brothers just...
We are a lot more advantaged because we don't have that, we don't injure as easily as a Caucasian skin type. So it's common that if you are Caucasian based, you are going to see a little bit more premature aging than someone who is a darker skin tone. And that's because the melanin does protect you from the sun.
And alcohol?
Alcohol is not really considered too bad within limitations.
So, sometimes you see men or women who drink a lot and they get
redness
and the broken little capillaries. What is that from alcohol and drinking, or is that just...
It could be a combination of smoking with alcohol. Okay, so usually with alcohol, unless you're like really chronically alcoholic or you have some kind of associated health issue, then you are going to see skin benefits. And obviously over time, you'll start noticing more skin changes towards the later part of life. But in the 20 to 40-year-olds, it is the sun that's going to show up more damage and then the smoking.
Can that be reversed? Can sun damage be reversed, or do you just help it to not get worse?
No, you can. There's lots of treatments that can help, make it improved. You're not going to take it away. I mean, you all have some degree of sun damage.
Yeah.
But if you're continuously in the sun while still doing these treatments, again, you're going to alter your progress. But there are ways that you can, reverse it to a degree.
A cheap sunscreen on the face versus a no sunscreen on the face?
Right now, there's a huge debate about whether sunscreen is good, and that's purely because of the chemicals. And now we're becoming a lot more aware of additives and things that we're putting on ourselves that we may not need.
Yeah.
Me personally, I'm still going to put a sunblock because I don't want to get that sun damage. So I'd rather risk any possible issues with
but surely
chemicals.
There must be those better sunscreens that
they do have more natural-based ones, zinc ones. It doesn't always... When it comes to a sunblock, the reason why people don't use sunblocks is because they don't like the texture, they don't like the white cast that it leaves on the skin. So when you're making a sunblock, it has to fit a certain kind of list of criteria so that your client is going to want to use it without it feeling like it's, a schlep.
Yeah.
So that's the problem. But generally speaking, I would rather do sunblock than not because we know the damages of no sunblock versus the possible damages of using it because of the additives.
And sunblock, is it applied to face and what do people call this place? The
décolleté.
The what?
Décolleté.
I heard it once when I was getting a facial and I was like, my what? And then apparently that's the whole thing. Okay, so décolleté.
Yeah.
Sunscreen there. Apparently it was says like back of the hands.
Anywhere
else?
Driving.
Yeah.
Okay, so if you're on the sports field, you want to be a little bit more aware, like in the pool and things. But generally speaking, the hands, they age because of sun exposure, especially because we're driving. Face, neck, and that part.
Décolleté.
Yeah.
And then when it comes to foods, do you find that in your clients, and this is a biggie, do you find that your vegan or vegetarian clients have better skin than your omnivores?
No.
Really?
No. You have to be really malnourished for it to show on your skin.
Okay.
Unless you are prone to skin conditions like eczema or psoriasis, then yes, certain deficiencies may make it worse. Thyroid, you may have dry skin if you have an underactive thyroid. But generally speaking, diet, it's mostly in terms of how it impacts on the hormones that then impact on the skin. So as long as you're having a fairly healthy diet, you should be okay. There's going to be a lot more impact in the rest of the body in terms of your cholesterol, your blood pressure, your weight, which is going to alert you before your actual skin starts showing. I mean, it may not look the best, but it's not going to be like, oh, okay, you're having this because you eat too much of fried foods. No,
okay.
really, yeah.
So now someone's decided they are whatever years old and the wrinkles, the crinkles are there.
Yeah.
And, have you heard of the book club effect? So you're in my book club. I will never get Botox. I'm so anti. But then you go and I'm like, oh, Vindea did it and she looks really good. Where did you go to? Oh, you went to Dr. Vindea Divine. So I'm going to go there too. And then so the book club effect. The one's got it.
The same like Instagram.
Exactly.
Yeah.
When I go now and I'm going to try and get Botox, which I've done, and I must say I was so anti. And then I was gifted it. And my first one actually was with your friend Gwen, Dr. Gwen Evans. And I remember just thinking, after about 10 days, it settled. And random friends of mine started saying, you look so,
refreshed.
Good. Like if you just had a holiday or asleep and there was a little headache I never knew I had that disappeared. But the one thing is, I would not tell anyone that I did it.
Okay.
And in fact, I don't even know, this might be the first time I've actually even said it, is because I was embarrassed, first of all, even though, hello, we all aged. But also because I was like, I'm putting this toxin in me and how can I do yoga and then do this thing? So let's talk about this toxin that is so popular now with everyone. What are we putting in ourselves? And is it like vapes when 10 years down the line it's going to come back and bite us?
So we've got a couple of brands. So we really call them botulinum toxin. Okay, so that's the base
Botox.
of what it is. Yeah. So Botox is like the brand. There's Dysport. There's Xeomin. So those are the three brands.
Okay, so
in
Botox
SA.
is a brand like Kleenex, but it's what is the whole word you said?
Botulinum toxin.
Okay,
Yeah.
so that's the thing.
Yeah. So botulinum toxin, Now, it's been around for a while, so since the 70s, 80s. So what it is yes, it's a bacteria, but we remove part of it, the labs do, so that it makes it safe for human use. So if you look at the botulinum toxin, it causes
paralysis, say it.
In the muscle, okay? So we're using that element of action in cosmetics. But before it started in cosmetics, it has a place in general medicine.
Yes.
Kids who have cerebral palsy, if they have, contractures, if you have burn contractures, if you have migraines. So it has a therapeutic need in general medicine.
I also heard people can put into their jaw as well for
bruxism or TMJ. So that is its place. It's just the cosmetic industry has made it popular. And how we use it there is that we relax certain muscles that cause an exaggeration of frowns or facial expressions, and then we get smoothness. So it's been tested. It's been around for a while. The amounts that we use on the face are generally safe so that there isn't a negative long-term effect. It just has to be used within certain safety guidelines, as with anything, that make it, appropriate for us.
How long does Botox last?
It varies, especially within the brands. Generally speaking, you're looking at about 4 to 6 months. Some may get a little less, some may get a little longer.
And when you choose who to go to, because unfortunately we're humans and we put money above all else, so we want cheap. We just think, what's cheap?
Yeah.
And so someone says, oh, how much per unit? And you're trying to fight for the cheapest unit. But at the end of the day, how do we choose who to go to? I mean, I know that you're saying you and Dr. Gwen are both doctors. She's a surgeon also.
Yeah.
But I know for sure that there's a beautician out there somewhere who's popping needles into frowns. So
technically, they're not allowed to.
Okay.
So if there's any negative effects or possible negative effects, you don't really have a case because you shouldn't have gone to them in the first place. Okay.
Oh, it's not the other way around. You've got a good case because they shouldn't be doing it. It's the other way around. You shouldn't have gone to them.
Yeah.
Oh.
So there isn't a body that's going to hold them liable unless you open up a criminal case, which is going to be difficult and all of that.
What could go wrong?
If you inject it incorrectly, you can get effects of incorrect injection sites. So that's why whenever we inject a patient, we'll counsel you about possible side effects if there's too much injected or if it's injected into the wrong muscle. Is that when you see like the eye, like dropped eyelid or a dropped brow? Okay.
But I mean, those will correct, right? Or
they will correct over time. But, if you're a first-time user and then your eyelid suddenly dropped, you're going to freak out. And there have been many TikTok posts on people like, look, I've gotten my eye dropped because of the Botox or the Dysport. So you want to make sure that if there is a side effect, and side effects happen all the time, it is limited to time, but your injector should be able to correct it or, at least talk you through it. So there, if you're choosing a provider, you want to go to somebody who is a bit more experienced. And perhaps, for me, most of my patients come through word of mouth. So again, if your friends had a good experience, then you're going to be a little bit more comfortable going to that person because you trust your friend.
Of course. Is there a minimum age?
18 is, the legal age for medical procedures or treatments without parental consent. We wouldn't just treat an 18-year-old because really, what is aging for an 18-year-old?
Yeah.
So there is some discretion. But if there's an 18-year-old who has terrible bruxism, then different. I would, yeah. So you have to kind of take it on a case-by-case basis, but usually you want to use your discretion in the best interest of the patient.
And is it ever too late to start? So I'm in my 70s. I've had a full life, and now I've realized actually, can you start then, or is it more better just... Yeah, is it possible?
There is some stuff that you can do. You have to have certain... you have to know what you want to achieve, and then you have to be realistic about what you can achieve.
Okay.
We're not surgeons. If you are looking for a very rejuvenated look, then perhaps facelift and plastic surgery is the better option. If you want to improve skin, then yes, you can start. We could do lasers. We could do peels. We could do other volumizing treatments. there's a lot of different treatments that are on the market that aren't neurotoxin and filler.
Okay, so you just said volumizing.
Yeah.
And there's also been a big uptake in the lips. And look, a lot of women look absolutely beautiful and gorgeous and luscious and fantastic, but there are some that have gone so ducky, and it's so obvious. Now, as a doctor, when someone comes in, and whether she already has filler in her lips or this is her first time and she wants more, where do you say, I'm not happy with doing this? Or is it one of these things where you're the client, whatever you want, I do?
No. At the end of the day, you still need to treat your patient in their best interest. So if you keep putting a product that has no need, you're going to create a result that's not going to be in the best interest of your patient. Plus, you're going to get other complications. And we can talk about that if you want to. But at the end of the day, you need to make sure that your patient is feeling confident, but to a point, because there is something called filler blindness, where people stop seeing their filler and they just want more and more and more. Yes. So you as a provider also need to understand that your patient is, a lot of times, a face of your work.
Yeah.
So if you're doing things that don't correlate with your aesthetic image, then that's going to be a disservice to your business.
Because someone says, who did that?
Exactly. I need to stay away from that.
What is filler? So there's Botox and filler.
Yeah.
Some people go for one, some people go for the other, some people go for both. So Botox,
they
we
have
know...
different indications, though.
Okay, so we've heard that, and I know that I'm calling it Botox, and that's the name of a brand, not the actual thing, but you know what I mean? That's going to paralyze the muscles. What does filler do, besides obviously fill? What is it?
So it's hyaluronic acid. So in our skin, we've got collagen, we've got hyaluronic acid. It's a plumping molecule. That's what fillers are, okay? But they're made in different consistencies or thicknesses. So some fillers give you more volumizing. Some fillers give you more hydration. So depending on the area of the face, what you want to treat, you're going to choose a product accordingly. So let's take the lips, for example. We can volumize the lip, reshape it, define it, give you that perfect lash full pout. Or if you want to be more conservative and you're just worried about fine lines or a bit of hydration, then we don't do all of that and we just focus on the skin health of the lip. There's lots of ways that we can approach a patient. It all just depends on, firstly, what their expectations are, what they're wanting, and also what you advise them is suitable for them and so what looks good.
This
hyaluronic acid, HA.
Thank you. It is found naturally occurring in our bodies, but the amount that is put in, I mean, I know I'm asking you this, but from a safety perspective, is it going back to the vapes? Like, we think it's good, 15 years, who knows?
I mean, there was this big post on Instagram now where they did MRIs and you could see filler that's been lasting there for the past 8 to 10 years. So before we were led to believe that your filler is going to absorb and you need to touch it up all the time, okay? Now, where that misconception came from could be from the companies that sell the products, or just could be that
you go back every year and do.
So it's always best that when you're doing things that it's if you still need it. Do you know what I mean?
Yes.
You don't just add on because you're scared that it's going to wear out of your system. Okay. But what was your question again?
With the filler, do we know what's in it? Like, is it good for us? Or,
it's very, very similar to our natural occurring HA. Okay. So there isn't really any side effects in terms of injecting it into our body. Again, it comes down to which brand are you using? Is it approved? How are you injecting it? Where are you injecting it? And how safely you're injecting it.
Okay. And this, again, is coming down to making sure that whoever you go to is reputable. Do you have lots of guys coming in? And without, obviously, I'm not asking for too many stories or for you to tell any patients anything. But because when we think aesthetics, we do think women.
It's feminine, yeah.
And when I went and had breast augmentation, my doctor, Paul McGar, he said how many men came in for, I think it was the calf surgery,
okay,
actually.
that makes sense.
We know you boys. But they said the men wanted to come in like back doors. They don't want anyone to see them coming into the room even, because men have just not been given the space to do this kind of thing. So from a male's perspective, straight or not, do you get as many men, half-half?
We don't get as many. It's still a very unknown world for them. Okay, so they don't really understand why they need it, if they need it. A lot of the times, if they do come, it's because their partners have brought them through.
Okay, yeah, the girls are like, you're cute with the wrinkle, but this is
but
too
let's
tired.
just, dial it down a bit. So a lot of times they do come in because of their partners. So it's still an emerging market. Of course, in different parts of the world, it's a bit more available and more in vogue than some places. So it just really depends on where we are. Our society or culture it's still emerging. So some males are a bit more aware of their aesthetic, how they look, and they want to do a little bit more, and they do the research, and they do come in on their own, but majority brought in by their partners.
I mean, I was just, because there was it doesn't feel like so long ago where I did not know one person who had Botox or filler.
And now everyone has it.
Yeah, now of my girlfriends at least, and some of my guy friends as well, but of my girlfriends, it's not a question of do you have, it's a question of who do you go to.
Yeah. Again, we're becoming a society that's a lot more based on how we look and what we portray to the outside world. So we are more aware of that.
Do you think that's a positive? Or, I mean, I know from your job it's a
business,
positive. Yeah.
So, and I do stuff to myself. Like, I wouldn't not do treatments. But I don't see why we shouldn't. Like, we still all feel young inside.
Yeah, you're right.
I mean, like, if we're in our 40s, the society has a connotation about 40s. And just because we're told that we should be a certain way or feel a certain way doesn't mean that we should look it, because we don't feel it.
Preach.
So I don't see what's wrong. And, like, if guys want to do it, great, do it. Why not? If you had a doctor who was, like, at your barber, let's just say, or you'd get your hair, beard, ears waxed, all of that, a little bit of Botox.
That's true.
It would be a bit more acceptable, because, it's not you're going to this very...
There's a gap in that market.
Girly doctor, and you're, going to be seen by, for me, the lip doctor. It's not like that negative feminine connotation. But even if it was, so what? This is like 2024. But for those who feel a bit uncomfortable,
I do also think, and we spoke about this earlier, that there is such a parallel between our mental health and how we feel about each other. And I know for me, as soon as people started saying, you just look different, or you look, relaxed, it made me feel so much better about myself, that I would see a really beautiful woman. And then when I felt beautiful as well, I was so much nicer to other women, which I saw that knock-on effect of the confidence. But then I also think what happens is, and as you said, what do you call it, filler blindness.
Yeah.
Then you're used to it. And then you get used to it, and then you want more, and then you want more. And then actually, can our self-love take a dip? Because now we feel like we need extra. I mean, how does that...
We're still aging. No matter what we do, we are still aging.
Yeah.
We may be slowing it down, but we're still aging. So at some point, you're not going to look like how you looked 20 years ago. And you can do all the treatments in the world, but you're still not going to look like how you looked in your 20s.
Yeah.
So there is a certain degree of self-awareness and real, expectations that need to be
reality.
To be modified, because you can't come in for one appointment and then expect to walk out looking like you did.
In I don't want to say names, 'cause I think it's nasty, but there's some American actresses who've done something, and it all gives them this
snatch look.
It looks like that.
Yeah.
What's that from?
Most likely it's from a facelift.
Oh, really?
Yeah.
I thought that was like filler gone wrong or something.
No.
Oh, a facelift. Does that make that happen? So why would one do that?
Saggy skin. And you want a bit more lift and tightness.
Okay.
And you're still young, so you don't... But I often get patients coming in saying, I just want to look like that.
Okay.
Can you just lift me up like that? Like, no, I can't do that, because that's actually pinchable skin.
Okay.
But also, why do you want to look like that? there is a certain like you said, reality check. We want to look normal. We want to look better.
Yeah.
Which is why aesthetics, the trend is coming back from what it was in 2020, 2022, where you see that very exaggerated, overdone. Everyone's scared of doing too much because it looks so obvious. It looks like a caricature of yourself. Huge lips, huge. I mean, the filters.
Yeah. Yes, exactly.
Which is another whole topic. But anyway, with the filters, like nobody wants that excessive look. Now you're seeing this emergence of a more natural aesthetic.
Yeah.
Lips have come down, cheeks have come down. You're focusing more on skin care, skin health.
So that's actually, I wanted to ask you, do you notice a difference in the skin of women who are avid collagen users?
With that, it's a little bit tricky. I always say, if you feel a difference, then continue it. Studies are still a little bit iffy on collagen. It has to be a certain type of collagen. It has to be taken in a certain way so that your body can digest it and use it, in a good way. It has to be a certain amount. So it has to be consistent.
Okay? Oh, yeah, good point.
So there is still a little bit of gray area as to take collagen, you'll definitely see an improvement. Also, a lot of patients aren't fully healthy in terms of what are your iron needs? What are your zinc needs? There's a whole other cascade that is needed to be at its optimal.
For your skin to show benefits.
So it is very much of an individual thing. And if you feel the results after 2 or 3 months, then by all means continue with it.
Look, I know I don't have much time left with you, but if you had to give me 1 or 2 foods, for example, are there 1 or 2 foods that you would say, these definitely are great for your skin and or antioxidants or whatever, or...
It's so hard. I think the more green you stick to, you're always going to be good. And the less changed it's going to be, it's always going to be good. Okay, so the fresher, the greener, the better. A lot of good stuff with fermented foods.
Okay, we've heard a lot about these, your prebiotics and kimchis and sauerkrauts.
So all of that is proven to be very, very beneficial. And that's coming from a long history of use, right?
Yeah.
Okay. Populations have had it for years. Their longevity is better. Their body functioning is better. Just their general health is better.
Yeah.
We have a resurgence of Ayurvedic things.
So nice.
Okay, so turmeric and garlic and ginger, all of these things. We used to use it before there was big pharma.
Let food be thy medicine.
Exactly. Hey? We're going back, and I'm here for it because there is such a nice thing. Just open up your cupboard, open up your go into your garden, pick the fresh stuff. It is going to have a good knock-on effect. It's just that you have to be consistent with it. You have to prepare it. So, the reason why we take supplements and things is because it's made for our lifestyles.
Yeah, absolutely.
But if you can, then great. I mean, that's why the smoothies are doing great.
Yes.
That's why, little collagen boosters in your smoothies, that sort of thing.
I'm so excited. We've got a little pack for you outside. And I'm pretty sure that there's the superfood one in there I think you're going to love.
Yeah.
But if someone wanted to come and see you for a consult and possibly, just come for a hug and maybe a little bit of forehead paralysis, how do we get hold of you? Where do we find you?
Yeah, so I'm on Instagram at Vindea Padayachi. They can find me there.
Divine.
Or just Google me.
Thank you so much.
It's such a pleasure being here. This is such a cool thing to do.
Yeah, and thank you for just opening up for this because I do think it's still a little bit of a weird topic for some. And so it's...
I mean, you're still going to get people who are all for it, people who are dead against it. Again, each to their own. But at the end of the day...
And again, and I'll say it, and it's something that I haven't always just spoken about because I kind of feel like it's no one else's issue, but I actually went to Dr. Vindae's partner for the very first time I ever had Botox, and I can only say positive things about how I feel about myself, how I feel like it turned out. I can still move, you can just get it suited to yourself. So find the right practitioner, find the right person, the right doctor, not just a random.
Be comfortable with them. Make sure. The other thing is that it has to be accessible. So don't break your budget.
Yes, say your budget.
Save for it. Your budget. Work within. If you have a good provider, they're going to be able to customize their plan, and help you on your journey. Again, it's not like a one and done treatment.
Yeah.
It is a commitment to it.
Exactly. And if you're watching this and you feel like you're being judgy and you want to just say age with grace, etc., you do you, boo.
What is age with grace?
That's the thing I say, let everyone do their own thing. As long as your children have got food in their tummy and you want to put a $2,000 into your forehead, baby girl, you do that.
Yeah, 100%.
Oh boy. Well, thank you so much, really. Thank you.
Thank you for having me.
Thank you for watching. If you have any comments, please write underneath. Remember, do your part, leave a heart, and we'll chat to you next month. Bye.
Bye.
Thank you for watching the Well I Am podcast. And if you enjoyed what you saw, please like it, share it, and subscribe. If you have any comments, comment below. We will get back to each and every one of you. And if you would like to know more about us or you want to get some products, welliam.co.za.